I'm Dr. Tracy Parnell. I'm the Global Director of Communications for the International Institute for Restorative Reproductive Medicine, and I am so grateful for the opportunity to be here with you all. I am an academic, but for those who know, I've combined my goals and objectives. Don't judge, okay? We really want this to focus on understanding and an appreciation for what restorative reproductive medicine is, and to give a voice to IIRRM patients and clinicians. I want to emphasize this is not an anti-IVF presentation. What we are hoping for is the opportunity and a call for respectful dialogue and the rights of our patients to have access to treatment that they are requesting. How we're going to accomplish this? We will have 3 of our board members do brief presentations. I'm going to cover the history and a brief outline of restorative reproductive medicine. Dr. Stanford will cover research, and Dr. Monica Minger will cover the current state in the United States here. Interspersed between each one of our brief presentations will be patient and clinician testimonials. We are here because of our patients, and we want their voices to be heard. So a lot of this will focus on them. Like many of the people in this room, I had a journey to restorative reproductive medicine. It did not happen overnight, and mine is a little bit unique. I did serve in our Canadian forces. I am Canadian. And I was fortunate enough to be working in a military environment, providing care to soldiers. And I was scheduled to see a patient that I had seen multiple times, she and her partner. And she came in. She had had a history of horrible, painful periods, irregular bleeding, and she was just frustrated. So she comes down. Now, I had scheduled just a short visit, so she was in front of a desk, and I said, we have gone through, this is the next treatment we're going to do. I think it was her 7th change of prescription. And she looked at me with frustration, and she slammed her hands down. And she said, and she was a very, very tough lady, and she said, Dr. Parnell, how does that fix me, and what is wrong with me? And that hit me, because I had many years of training. I had been personally mentored by Dave Sackett, the father of evidence-based medicine. I knew all the guidelines. I was providing her the best care according to everything that was published. And I could not answer those questions. And I vowed then that I would find a way to explore and find this. And we have. Now, reproductive medicine has actually been on 2 divergent paths since the 70s and 80s. The one, which of course is the more dominant approach, has very heavily led with symptom management, often with hormonal suppression, and high technology that allows bypassing of infertility. This is, of course, what most women and patients are familiar with. The other branch was very much concerned that having access to a medical model where diagnosing and treating the pathology was key to better health and to outcomes that would lead to overall healing. Now, my patient was interested in healing. She was in a same-sex relationship. She was not interested in having a family, but she wanted, and so did her partner, a healthy body, and answers. For the purpose of this presentation, we are going to focus on infertility, but restorative reproductive medicine is able to deal with a breadth of issues in reproductive medicine. So, in the 80s and the 90s, doctors who were questioning and looking to see, is there another way for us to do this, would meet up with each other at meetings, educational events, and we would always say, you know, we really have to do something. Finally, in the year 2000, we did something. So we had a series of meetings in London, England, and at one of the meetings, which took place at the Victory Service Club, we proposed the term restorative reproductive medicine. It was embraced with great enthusiasm, and we defined the field. And the International Institute for Restorative Reproductive Medicine was born at that time. So we have been around for a while. Starting in 2000, formally, the International Institute is the professional body for restorative reproductive medicine. We have professionals in nearly 80 countries across the world. This is not new, it is not small. We provide education through accredited bodies, we have a journal, a registry, and we maintain a clinician recognition program. You cannot just say, I'm an RRM physician. You actually have to have some association and criteria met to utilize that designation. Dr. Stanford will talk more about some of those aspects. What is it? And there is a lot of debate about what we are, which we find ironic because we're happy to share what we are. So it is a medical discipline. Our goal has always been to evolve into a specialty. Now that is a long journey, and oftentimes it is fraught with controversy, especially when you branch off from an existing field of medicine. There's plenty of research in the literature demonstrating this in other fields. Of course, the changes that have happened here in the United States, we were pleasantly surprised when we heard about the Restore Act, and all of a sudden there was significant interest in restorative reproductive medicine. It was a little different timeline than we had been on, but we welcomed that opportunity to share with more people the opportunity to know what RRM is. So a medical discipline that uniquely focuses on supporting and restoring normal physiology and anatomy of the human reproductive system for men and women. We often get the message that, it's a little bit of diet and, you take time and then magically you're pregnant. That's actually kind of disrespectful for all of the patients here, none of whom magically changed their diet when they went to see an RRM and became pregnant. This is a journey, and it's a journey for the patients, and it's a journey for the clinical team that helps them. We do a lot of different things. We do address lifestyle, right? You can't be doing all of this heavy intervention and just ignore diet and lifestyle because that doesn't contribute to health. We do have cycle charting and investigations, medications, and very advanced surgical techniques. All of that comes together in providing restorative reproductive medicine. I'm going to speak just for a second on the charting. RRM is not a charting method. RRM is a field of medicine. Charting is a tool that we use, and there are a variety of science-based tools that most practitioners will utilize. The chart is not just a time it for intercourse. It is not just an indicator of the cycle length. Very much like an ECG, a heart tracing. If you come in and you have chest pain, we're going to put a heart tracing, an ECG on you, And somebody who's trained will be able to read that and be able to come up with what we call a differential diagnosis. What are those abnormalities pointing to? And then in restorative reproductive medicine, this chart also allows us to be able to precisionally time interventions and testing. We know exactly what phase of the cycle a patient is in, and we precisely measure their hormone levels, precisely do the ultrasound testing and all the other components, because the patient tells us they're an active partner in this. So here you see some abnormal cycles. This is a differential diagnosis, okay? This is very comprehensive. This is not just, let's adjust your thyroid and hope for the best. This looks at a lot of factors that contribute to infertility and ill health, right? The chart points us that way. The precision evaluation lets us determine what we're dealing with, okay? Precision labs for men and women. I just came back from an amazing conference in Italy where it was on restorative andrology. Wow. The stuff we're able to do for male infertility is a game changer, okay? So this is some of those tools. We also have heard, well, you know, if you were stuck doing the same things you did in the 70s and 80s, well, that's not good medicine. Yeah, well, that's not what we're doing. This is trailblazing surgical techniques, restoring and repairing tubal damage, pelvic reconstruction, endometriosis surgery. All of this uses microsurgical techniques, robotics, cutting-edge technology, all put into the service of restoring that patient's health. And then you know what we find? That little chart that the patient is empowered with the knowledge about their body, that chart also tells us that things are improving because it normalizes. And the patient is the first one who knows this. They come in, they're like, Dr. Parnell, look, I have a normal cycle. Look, and they can tell you, my peak day is this, my luteal phase is here, and you know, my mucus cycle score is this, and my menstrual cycle score is this. They know their body, and it's amazing. Okay? Now, these groundbreaking treatments come together to have very good outcomes for patients. So this is actually a recent publication by our colleagues over in Europe. This is male factor. Again, we keep hearing male factor isn't dealt with. Actually, we deal with it really well. The left bar, again, is the IIRRM outcomes, in this case, mostly restorative andrology. On the right is comparative IVF data for this particular study. Quite impressive. More impressive is the fact that this deals with improving long-term health. We now know that male infertility, female infertility, it's just not about having a baby. Those are markers for long-term health consequences. And they need to be dealt with to ensure the patient not only is able to conceive when they choose and how many they choose, but is able to actually live a long, healthy life with their family. Okay? IIRRM in 10 minutes, it's tricky to do, okay? So we look forward to questions. Now, what I'm going to do is I am going to turn over to our colleagues, and they're going to talk patient, okay? And you're going to hear this as a common theme. IIRRM is as effective, it's less invasive, it's less expensive, it's healthier with less abnormal or poor perinatal outcomes. Our babies are born at term as a singleton baby with a healthy weight. That's what every parent and every mother and every physician is looking for, okay? So I'm going to introduce Dr. Kim Barrows, and she's going to come and then she'll present some patients as well. Thank you, Dr. Barrows.
Good afternoon. My name is Dr. Kim Barrows. I'm a board-certified family physician in Grand Rapids, Michigan, and I've been practicing family medicine for 26 years, and the last 13 years I've specialized in restorative reproductive medicine, or RRM. My journey into RRM began with actually a personal heartbreak, a miscarriage at age 39. And then my OB told me that my progesterone level then was too low to sustain another pregnancy. I began researching treatment options, and I found an RRM practice that would be able to see me from another state remotely. But with their support, I delivered a healthy baby boy at age 40 and another one at age 43 while in the midst of training for being able to provide RRM care myself. Since then, I've had the privilege of helping hundreds of couples realize their dream of parenthood, many after years of infertility, failed IVF cycles, repeated losses. And one patient that's particularly memorable had 12 consecutive miscarriages, no live births. And now, at the age of 40, she is cradling a healthy baby boy. Currently, I'm one of only a handful of RRM physicians in Michigan. I've been able to reach couples from across the state, but this is not enough. Families really need more access to this care where they don't have to travel across state lines or wait for months and months on waiting lists. We need to train more physicians, support more research, and educate patients, clinicians, and policymakers about the power and the promise of RRM. So I brought a couple patients here to share their stories. The first one is Naomi and her husband Tim. Naomi is a maternal infant nurse and lactation consultant who spent 20 years in her personal journey trying to find the reasons for and the treatment for her persistent symptoms. When I met them, they'd been using an evidence-based fertility awareness method for about a year without becoming pregnant. We uncovered and treated celiac disease, other food sensitivities, hormonal abnormalities, metabolic dysfunction, and autoimmune factors. Naomi worked with a nutritionist also, completely out of pocket, and made significant lifestyle changes in addition to the medical work and medications that we were using. She lost 15 pounds, her symptoms improved. We began working with her husband Tim to explore his health as well. So Naomi can share.
Hello, and thank you for the opportunity to be here. My name is Naomi, and I am here to share with you from a nurse's perspective as well as personal perspective, as Dr. Barrows said, how restorative reproductive medicine benefits the men and women who have access to this care. Until 2 years ago, I had never heard the term restorative reproductive medicine, although I had worked for nearly 10 years in the maternal infant health care. I had worked with women who experienced infertility. Some of these women knew they did have underlying conditions like PCOS, hormone imbalances, or endometriosis, but were struggling to conceive even though working with fertility specialists. While others were able to conceive through the means of IVF, but were left with often debilitating symptoms that continued to affect their lifelong health. Fertility care became personal to me 2 years ago when my husband and I experienced infertility. I had been frustrated by talking with doctors since puberty about unusual symptoms I believed were connected to endometriosis, PCOS, food sensitivities, iron storage problems, and blood sugar imbalance. I even had 2 different surgeries where doctors identified underlying potential endometriosis and PCOS, but never addressed with me the ways I could be medically treated, and instead was only offered birth control to manage my symptoms. I was told that later in life, if I was trying to conceive and struggling, I would probably need fertility care. After a year of trying to conceive, someone mentioned working with a restorative reproductive medicine doctor. Through Dr. Barrows' expertise, she verified that my lab values and symptoms confirmed PCOS, endometriosis, celiac disease, genetic gluten allergy, and 21 other food sensitivities. Dr. Barrow identified that my thyroid medication had gluten in it, which she changed and also put me on medications to reduce inflammation and helped me change my diet. She also met with my husband and ordered labs and diagnostics for him as well, in case we were up against male factors for infertility. Within a short time, I was able to lose weight, caused from inflammation which was keeping me from being able to conceive. And with the changes in diet and medication, we conceived and are expecting our first child. The solution may sound, yes, thank you. This solution may sound simplistic, but I do not believe that a fertility doctor without the lens of restoration would have identified how these outside factors were so greatly impacting my fertility. And as a maternal infant nurse, I find it amazing that I had no idea this field of medicine existed. We truly need better access and awareness to help men and women throughout our country to get the help they need to build families naturally. Thank you.
Thank you, Naomi and Tim. I also want to introduce to you Krista. Her journey spans multiple states and countless hours of travel just to access care. I met Krista in September of 2024, shortly after a miscarriage and with a new diagnosis of an autoimmune condition. We focused on improving ovulation, optimizing her hormones, and reducing inflammation from autoimmunity. After 5 months of optimized cycles, Krista conceived, and she's here to tell the rest of that story.
Hello, my name is Krista, and I have been a patient of IIRRM for the past 7 years. When my husband and I were having trouble getting pregnant at first, we had some initial testing done. We had a consultation at an IVF clinic where the doctor took a look at our test results and said everything looked great. She diagnosed us with unexplained infertility and gave us a 2% chance of conceiving on our own. She suggested 3 months of intrauterine insemination followed by IVF. When I asked if less invasive methods could be used first, such as ovulation induction medication, she rolled her eyes at me and insinuated that this would be a waste of our time. This meeting didn't sit well with us. We decided not to pursue artificial reproductive technology due to the high cost, the ethical implications, and because the diagnosis of unexplained infertility gave us no answers. Instead, we found a doctor in our area who ran a restorative fertility clinic. 7 years later, I have conceived naturally 3 times. Due to many moves for my husband's work, I have had the privilege of working with 4 different IIRRM doctors in 3 different states since 2018. Through their thorough testing and analysis, our infertility became far from unexplained. We uncovered hormone deficiencies, a genetic mutation, food sensitivities, underlying inflammation, autoimmune markers, weak ovulation, and even endometriosis, all of which were contributing to our inability to achieve a pregnancy. These underlying issues also could have threatened a pregnancy had we conceived before treating them. I know much more about my own health than I ever would have discovered otherwise. I am incredibly grateful to be a mother, and I only wish that this type of medicine was more widely known about and readily accessible. This is true women's health care, not treating symptoms and ignoring underlying issues, but tackling root causes and caring for the whole person. If we are going to prioritize women's reproductive health in our country, then IIRRM needs to be part of the conversation. Thank you.
Good afternoon. My name is Dr. Marguerite Duane. I am a board-certified family physician, co-founder and executive director of Facts About Fertility, which focuses on educating the medical professional community who are new to the fields of fertility awareness and restorative reproductive medicine about the science underlying these methods and this approach. It started with a small elective at Georgetown 15 years ago with 9 medical students. We've now trained over 1,000 medical students. I also serve as the inaugural director of the Center for Fertility Awareness Education and Research at Duquesne University, and I have my own private house calls-based direct primary care practice right here in our nation's capital called MD for Life. Through MD for Life, I am able to provide restorative reproductive medicine services to a number of patients. And since starting my practice in June of 2022, I have had 39 patients seek care for infertility and recurrent miscarriage. 34 of those 39 patients have conceived. 28 have gone on to have a live birth, giving me a 57% live birth rate as of now. We still have 13 ongoing pregnancies. My current miscarriage rate is 16%, which is standard. More importantly, in 2020, I had the opportunity and the privilege, honestly, to do a research fellowship under the direction of Dr. Joe Stanford, who you will hear from shortly. And through that experience, we published a fairly large comprehensive review of the role of fertility awareness-based methods in restorative reproductive medicine, from addressing women's health perspectives to using it from a family planning perspective, a true family planning method for couples interested in using it to avoid and for couples in using it to achieve. I've had many patients come to me seeking pregnancy, and I'm delighted to introduce you to one in just a moment. But beforehand, I want to tell you about one other woman who was not able to be here. This woman had sought infertility care for nearly 5 years through conventional IVF approaches. She herself was trained as a physician assistant, but had never learned about restorative reproductive medicine. And after 4 years of IVF, came to me in November. And within 4 months, following identifying and treating underlying health issues, including insulin resistance and endometriosis, she had surgery with Dr. Patrick Young. She is now 25 weeks pregnant, when she, like many other women, were told, you will never conceive naturally. It is critical that we identify and diagnose and treat the underlying diagnoses. Now I'd like to introduce my patient, Emily. Emily and her husband, Greg, came to me when they were struggling with infertility. Like many women, Emily had suffered with irregular cycles and painful periods, had been offered birth control, an IUD, which resulted in chronic discharge. She also had an underlying autoimmune disorder, none of which was fully addressed. When she came to work with me, we systematically addressed factor after factor after factor. And when it wasn't enough to address Emily, as a family physician, I was able to provide care for her husband, Greg, and identify and treat underlying male factor issues as well. I will let Emily take over sharing her story. And if anyone is interested in receiving a copy of this paper, we have plenty of them around if you're interested in updating yourself on the science supporting this approach. Emily.
Hello, my name is Emily. I am married to a Marine, have a beautiful 14-month-old daughter, and in my spare time, I'm an orthopedic and pelvic physical therapist. My husband and I experienced infertility for 4 years after getting married. Despite being a physical therapist in the pelvic health space, I didn't hear of restorative reproductive medicine until 2 years into our conception journey. Through IIRRM, I learned that my menstrual cycles were not normal and that my hormones were, in fact, very, very low. Through Dr. Duane's expertise, we were able to improve my hormone levels, but my husband and I were still infertile. My understanding is that 30% of the time, infertility is an issue with the woman, 30% of the time, it is an issue with the man, and 40% of the time, it's both. Knowing this, my husband was also tested for infertility and found to have some issues. Despite improving our reproductive markers, however, we still couldn't get pregnant. We were never told, sorry, this is all we can do, or you need to try IVF. Instead, Dr. Duane believed something anatomical contributed to my infertility and recommended a laparoscopy to look for endometriosis. I had no symptoms at the time to suggest this beyond infertility. As a PT, I am wary of surgery. I've had many patients undergo repeat surgeries for endometriosis because they saw surgeons who don't use the same techniques as IIRRM surgeons. My IIRRM surgeon cleaned up cysts, adhesions, and polyps, and a little over a month after surgery, my husband and I saw our first ever positive pregnancy test. Our journey with IIRRM didn't end there. During pregnancy, I continued to have low hormones, despite my OB, who was not an IIRRM doctor, telling me that I didn't need to have my hormones monitored during pregnancy. Dr. Duane emphasized the importance of optimizing my hormone levels throughout pregnancy to decrease my risk of miscarriage. If I had simply listened to the OB doctor, there's a chance our daughter wouldn't be here today. IIRRM isn't just about conception, it's about restoring health, which is exactly what I think every doctor would like to do when they leave medical school. Thank you.
Hi everyone, I'm Dr. Nicholas Kongwasa, and I am a board certified OBGYN, and I'm also the fellow of the American College of OBGYN. We have a private practice that is based in Atlanta called Reproductive Health Medicine and a gynecologist, and we have satellite offices in Birmingham, Alabama, and in Arlington, Virginia. I think that with RRM, it should be a choice that needs to be given, needs to be available for women, and women needs to be supported with this choice as well. I'm gonna have a couple of my patients come up and share their story. The first is Leah Hatton. She's our nurse and she's a market instructor, and yeah.
Hi, like Dr. K said, my name is Leah. I'm a registered nurse who lives in Virginia. And in 2020, I began a journey no one ever wants to go on, recurrent pregnancy loss. Within 18 months, I went through 3 consecutive miscarriages, which was emotionally and physically draining. My OBGYN didn't have any answers for me and really didn't want to look for them. When I asked for certain tests to be run or if monitoring my cycles would be helpful, I was met with suspicion or rolled eyes or told, well, you could just try IVF. I sought a second opinion with Dr. K, and his team immediately met me with compassion and proactive, not reactive care. They ordered blood work, they had me monitor my cycles, and they gave me hope. And within a few months, Dr. K was able to tell me that there was indeed a reason why my babies kept dying inside of me. And even better, that there was a very simple solution. I have a gene mutation that you've probably never heard of, but it puts me at higher risk for blood clots. And this was vital for me to figure out why I was miscarrying, but also for my overall health. There are certain medications, activities, and lifestyle choices that I need to be aware of because of this increased risk. Since implementing a blood thinner in pregnancy, I have not had a single miscarriage. I have 2 children who are here today because my RRM physician cared enough to find out why. And it's insulting to all women to call RRM unscientific. My previous physician could not even be bothered to run basic labs and suggested I undergo a process that would cost me thousands of dollars and maybe not even work. He suggested IVF and washed his hands of me, and RRM dug deeper. They told me something invaluable about my overall health, and they gave me a solution that allowed me to carry my 2 children to term. I did not feel like a product in a baby machine. I was a person, and I was a human being that was searching for answers and health, and RRM gave me that.
Bravo!
Next, I want to introduce Catherine Hadro. She's another dear patient of ours. She had surgery, and then, yeah.
Thank you, Dr. Kongwasa. My name is Catherine Hadro. I'm a television news anchor, and I live here in the Alexandria, Virginia area. I met my husband a year after I moved up to D.C. We dated, got engaged, and got married in February 2018. And we both expected to have a baby in our arms just in time for Christmas. But the positive pregnancy tests never came. It was a shock to someone who always was seen as perfectly healthy, or so I thought. I saw a doctor concerned that pregnancy was not coming easily, and I was told, well, you don't have PCOS, you're not overweight, come back to me in a year. 2 years into trying for a baby, I got connected to Dr. Nicholas Kongwasa and his RRM practice. Within my first conversation with him, he accurately diagnosed me with endometriosis. We prepared for my surgery, and in the meantime, he ran additional labs and ultrasounds. I did, in fact, have PCOS. We'd have to treat my infertility both hormonally and surgically. I wish I could say that I conceived this cycle after my endometriosis surgery, but that's not my story. More time passed, and no baby came. But to Dr. Kongwasa, this was not a setback. No, it was more information about my body. We learned more each month, each cycle. His team discovered that while my labs looked normal, I actually had subclinical hypothyroidism and insulin resistance. Easy to miss. A clearer picture of my health was coming into view. 4 years into my infertility journey, my 67-year-old dad died suddenly, cardiac arrest. My family and I wondered what kind of signs we could have missed. Losing a close family member when all I wanted was to grow my family felt like a cruel joke. 3 months later, Dr. K's team happened to run a specific set of autoimmunity tests on me, revealing I had a blood clotting disorder. Wait, no, I had 5 blood clotting disorders. blood clots, a common cause of heart attacks. This is valuable, life-saving information for me. And now with all of this hard-earned data about my body, Dr. Kongwasa connected me with a doctor who works with women who have autoimmunity like I do. And 5 months after getting on her prescriptions, more than 6 years into my infertility journey, I conceived my baby. And I gave birth to my daughter, Lily Jean, exactly 8 months ago to the day. I don't know why I had to wait 6 years for a baby, but I do know while I was falling into despair amid infertility, restorative reproductive medicine instilled hope into me. I was never told, you have unexplained infertility. There's nothing we can do here. My care was tailored to me. And as complex as my litany of diagnoses may be, Dr. Kongwasa's team was a team of medical detectives translating what my body had been saying the whole time. I can now look back on my journey with gratitude. I'm equipped with life-saving information about my own body, and I'm healthier. Not only do I have a healthy baby, but my healthy baby gets a healthy mommy. Thank you.
And so this is the dry part of the talk. I talk a little bit about numbers. So I'm going to talk a little bit about diagnoses, outcomes, a little bit about the registry you've heard about, and the journal that medical journal we've had. I think this has been pretty well highlighted by the patient testimonials that we don't believe in unexplained infertility. We want to find the underlying factors. Now, that doesn't mean we know everything. It doesn't mean we've discovered all the possible factors, but we do know quite a bit of things that we can identify. And in the multi-center study called INS that is, and the reference there, the mean diagnosis per couple was 6. So if you treat these underlying diagnoses, you improve natural fertility. You also improve the health of your patients, the parents, and you improve the health of the child that will come. So I want you to do a little thought experiment with me for a minute. We have 2 treatments for fertility. These are not specific, these are hypothetical. Treatment A has 80% live birth rate, but the women in the study had an average age of 23. They'd been trying to get pregnant for 1 year. They had no prior treatment, and they all had a prior birth. Okay, that's treatment A, 80%. Treatment B has a 20% live birth rate over 2 years. The women's age is 43. They've been trying to get pregnant for 10 years on average. They've all previously failed IVF. And none of them had previously had a live birth. So these are 2 hypothetical studies. So I want a show of hands here. Who thinks treatment A is the more impressive, effective treatment? Okay, and who treats treatment B as the more effective, impressive treatment? Okay, and who's not committed because you haven't, most of you didn't commit. It's not that there's an absolute right or wrong answer here, but the point here is that treatment B is more impressive because you're dealing with a far more difficult underlying population to deal with. So you cannot interpret fertility statistics without knowing something about the prognostic factor. Female age is talked about a lot, and that's a huge one. That's why we have, age 43 versus 23 here. But there are also factors of prior pregnancy, how long you've been trying, prior treatment. And if you don't have those, if you don't know what those are, you don't have a complete picture of how to interpret that live birth rate. So let's apply this to some real data. Okay, so these are 3 studies out of the numbers I could have brought. 2 IIRRM studies, one from Ireland, one multi-country, and then IVF registry data from the US, from the CDC. And the time frames are listed. I won't go into that in detail. One retrieval for IVF could result in multiple embryo transfers. So, and that could take a period of time that's not usually well defined. So we have a live birth rate here, 18%, 44%. These are crude rates, by the way. They aren't. We're not adjusting for dropouts or anything. They're just the crude rate. And people drop out. They just don't count. So it's a conservative rate. 18%, 44%, 44%. live birth. So you could say, okay, well, one study looks about the same as the other, a little bit, take a little longer. But again, what are the now by now, if there's nothing else you remember, you should hopefully, after I've talked to you, remember what are the underlying factors? What's the age? How long they've been trying? Have they had a prior birth? So if we look at that, the mean age is a little bit less in one of the studies, a little bit 37, 34, 36. The prior births, 22% in one of the IIRRM studies, 24%. Another one. The first IIRRM study there is actually a study specifically of people who tried IVF and failed. So 100% had previously had IVF. The second one was a more general study in 4 countries, 7% previously had IVF. And I want to point out that at least the standard registry statistics published in the US don't give us all the data we'd like to have. We do have women's age, that's good. But we don't have their prior birth history, we don't have their prior time trying, we don't have their prior IVF history. So it's really an incomplete picture of what those numbers actually mean. So that's hopefully you get just a little bit of sense if you need to know the underlying prognosis before you can interpret the numbers. Also, another important factor here is not just that the birth happens, is it a healthy baby, and one measure of that is what's the measure of normal birth weight or low birth weight. And there's a 7% for one of the studies and then 12% for the IVF registry, which to their credit is a lot less than it used to be, but it's still a little bit higher. So I'm going to talk about the registry that we started called the Surveillance of Treatment of Outcomes in Restorative Reproductive Medicine. There's a lot more about this that I don't have time for, but just to let you know that we do recognize the value of registry data, and we're applying that in the restorative reproductive medicine field, including several of the clinicians you've heard from or will hear from today are participating in this. We currently have 9 clinics in 3 countries to look at our actual outcomes of what are the live birth rates and the low birth weight rates and these outcomes for restorative reproductive medicine. And I want to point you to that if you want to know more about the evidence that's being developed and published in this area, to look for the Journal of Restorative Reproductive Medicine online. It's peer-reviewed, open access, and we have some articles up and more coming out. I've published in most of the mainstream reproductive medicine journals over years, and they do a good job in many ways, but my experience has been that it's been more difficult to get some of these ideas understood and give a fair hearing. So we have this new journal, peer-reviewed. Take a look at it, and that's where you'll see evidence coming out in the future. Thank you for your time. Oh, and I think Dr. Pudoff is up next with the patients.
Good afternoon. I think I probably speak on behalf of everybody. We could probably listen to these patient testimonials all day long and never get bored. It is truly inspirational. Volume. Sure. My name is Dr. Gavin Pudoff. I'm the founder and medical director of Veritas Fertility and Surgery in St. Louis. I'm a board-certified OBGYN specializing in restorative reproductive medicine and restorative fertility surgery. It's my pleasure to be here today to introduce my patient, Kaylin, who will be sharing her incredible story of healing and restored fertility. Despite years of seeing other doctors for infertility, Kaylin and her husband, Wade, who's with her here today with their baby, had never been told the why behind their infertility. Instead, they were simply given the easy diagnosis of unexplained infertility, as many patients are. Kaylin had also experienced years of severe pain with her cycles, which was a symptom that had never been evaluated by the doctors who were seeing her previously. I suspected that she had endometriosis, given the fact that 80 to 90% of women with infertility and pain have endometriosis. Kaylin underwent a robot-assisted laparoscopic surgery for the excision of this disease, and we completely removed all of her endometriosis in one surgery. This surgery immediately restored Kaylin's health and fertility, and less than 3 months later, she was pregnant for the first time in her life. The work we do with restorative reproductive medicine and restorative fertility surgery gives women more than the gift of fertility. That's a great gift, but that's not all it gives. It also improves their overall health for the long term and allows them to conceive a pregnancy in a state of health, which is crucial and important, something that they would not get through the IVF process. All of us here today, I think I speak on behalf of all of us when I say that our patients, women and couples everywhere, deserve this type of restorative care. Here's Kaylin.
Hello, everyone. Like Dr. Putoff said, my name is Kaylin Woods. I'm a 32-year-old physician assistant from Missouri. So I'm here today to tell you all how restorative reproductive medicine has truly changed my life and the life of my family. So my husband and I struggled with infertility for 5 years that were full of follicle scans, appointments, medications, injections, and not a single positive pregnancy test. In addition to infertility, I also had very painful periods and increasingly frequent episodes of debilitating abdominal and pelvic pain. Our diagnosis was unexplained infertility. We were left without answers, and we were told the IVF was our only option. We had the IVF consult, and we were ready to proceed, but we thankfully sought one last opinion with Dr. Putoff. He was able to diagnose me with endometriosis within 1 hour of meeting by finding a large endometrioma on my left ovary that had never been discovered. So this might not seem like good news to be diagnosed with endometriosis, but to us it was the best news because it gave us an answer to our 5 years of infertility and to my pain. I underwent a 10-hour laparoscopic surgery to excise stage 4 endometriosis, which had also infiltrated part of my colon, narrowing it to the size of a pinky finger, which was a bowel obstruction waiting to happen. This was also fixed during the surgery. After surgery, my pelvic and abdominal pain were completely gone. I felt like a new person. 3 months after surgery, November 13th of 2024, we received the greatest news ever. We had our first ever positive pregnancy test, and we required no additional help to conceive. No follicle monitoring scans, no medication, no injections, nothing. My reproductive health had been restored, but more importantly, my overall health had been restored. 2 months ago, we welcomed our son into this world, and we have God and IIRRM to thank for that. I am so grateful that we were able to find not only the problem, but we were also able to find a long-term solution. Not only did IIRRM help me to become a mom, but helped me to feel well enough to be the mom that I always dreamed of being. Every woman deserves access to this kind of care, to not only help her conceive, but to become the most healthy version of herself. I no longer believe in unexplained infertility, just infertility that we don't yet have an answer to. IIRRM provides those answers for women. Thank you all for listening.
Good afternoon. My name is Megan Kreft, and I am an IIRRM trained physician assistant from Raleigh, North Carolina, and I work for my Catholic doctor. I'd like to introduce you to my patient, Ashley, today. After losing a baby to miscarriage, Ashley turned to IIRRM for answers. Standard of care waits until at least 2 miscarriages, until recently 3, before investigating. But even 1 loss can be devastating to a family. IIRRM asked why she was losing any pregnancies. We uncovered several underlying health conditions that compromised both her health as well as put her pregnancies at risk. By addressing these with lifestyle changes, medications, and hormonal support such as progesterone both before conception and during pregnancy, Ashley went on to deliver 5 healthy babies and improved her overall health. These are the strengths of restorative reproductive medicine: restoring and optimizing health, preventing loss, empowering patients, treating the whole person, and alleviating suffering. I hear from patients again and again, I wish I had found this care sooner. It's now my honor to turn it over to Ashley. Thank you.
Good afternoon. My name is Ashley Figueroa, and I'm a mom of 8 from Idaho. I want to share my story of hope. During my 4th pregnancy, I miscarried. I sat in my doctor's office devastated and desperate for answers. Instead of compassion or solutions, I was told the standard of care. Nothing could be done until I had experienced more miscarriages. In other words, I would have to endure that heartbreak 2 more times before anyone would even begin to ask why it was happening. I couldn't accept that. I was grieving, but I was also searching. That's when a friend told me about restorative reproductive medicine. For the first time, I was heard. Symptoms that had been brushed aside for years were finally taken seriously. Through thorough testing, I finally had answers, and more importantly, a path forward. We discovered underlying autoimmune disease, prediabetes, hormonal insufficiency, adenomyosis, conditions that explain not only my miscarriage, but years of health struggles. My treatment plan included progesterone, metformin, evidence-based supplements, DHEA, and both diet and lifestyle changes. But more importantly, I worked together with my physician, who not only saw me as an individual, but supported each pregnancy individually. It wasn't about fitting the patient into a protocol, but fitting the protocol to fit the patient. This proactive approach empowered me. My doctor took the time to educate me, both about my body and about how to optimize my cycles and my health. Not just preconception, but during pregnancy and postpartum. For the first time, I felt like a true partner in my own care. With this kind of care, my health improved and my family grew. Today, I stand here with 8 beautiful children, 5 of whom would likely not be here without RRM. RRM gave me hope when I was told there was none. My story is not unique. Countless women and families could be spared loss and given answers sooner if only this kind of care was more readily available and supported more widely. No woman should have to endure loss after loss before she's taken seriously. RRM is hope, it's healing, and it's the future of women's healthcare. Thank you.
Hello, I'm Dr. Naomi Whitaker, board-certified OBGYN, minimally invasive gynecologic surgeon, physician lead of UPMC, University of Pittsburgh Medical Center, Divine Mercy Women's Health, and also I'm a certified Creighton Model System instructor. My first patient, Divya, I would like her to share her story first, and then I'll explain kind of what the other story could have been if she had gone somewhere else. But I also want to mention that more information for educational purposes, including 2,500 plus research articles, are available at my my nonprofit called RM Academy. It's educational for the public, so all people have access to this information. I also educate on Instagram at Napro Fertility Surgeon, and we have a patient-facing group to unite together called Uterus Allies as well. So let me hand it off to Divya, and then I'll share some more information about her story.
Hi, good afternoon, everyone. This is Divya Ankirla, and my husband is Nikhil. He's outside. So today I want to share my story. So in 2019, we started our beautiful family, but unfortunately, we found out I was going through with endometriosis, and the doctors were said to me go for IVF, which I was not okay with that. Me and my husband were always want a baby with natural conception, and we got to know about RRM, and we found out Dr. Naomi Whitaker, and I'm grateful for her. And then later, she told me the conceiving is not only the one thing, but it's going to be tough for you because you have stage 4, because I had 2 endometriomas on both my ovaries. So she suggested a laparoscopic surgery, and I went to the surgery of 7 hours, and my husband was waiting outside, and he was always worried about me, and we got so much answers through that surgery, and she cleaned up everything. And then I was expecting pregnancy right after the surgery, which never happened. We had our own challenges because I had a pre-diabetes, and I went with luteinized underruptured follicle syndrome. And with that, we tried for 4 years of taking medications, going for ultrasound every day, and a lot of strict diets. I never enjoyed my food at that time. And a lot of things were going on. I was like depressed and stressed out, like why I'm not becoming a mom. I want to be a mom. When I'm trying everything which is not working for me, then Dr. Whitaker called me one day to her office, and she told, it's time to take a break for your body and your mind. You need to come out of the stress. Enjoy the life what you had before, then come to me. And I told, I want to go for second surgery. And she told, not the second surgery, to be a solution. You need rest. You need to come out of the stress. And I didn't understand at the time. I was enjoying my paintings, I was enjoying my dog, and I was traveling all around. And all of a sudden, within 1 year, I found out on January 21st in 2024 that I was pregnant. It was really shocking for me because after trying all of this, why it didn't work out and why I'm pregnant now. And I went to the doctor's office on the same day and she told, you should be happy. Yeah, I am happy, but I don't know what to do with this pregnancy because I want to hold the baby. Am I going to hold the baby? And she told, you're going to hold the baby. And I had on my challenges like pre-diabetes during whole pregnancy. And she told, you will hold the baby, trust me. And when I hold the baby, that was the miracle for me. So then again, back to my story is like, so when I got suggestions like IVF, my own family owns an IVF center in India, but they are not part of it now because my father-in-law is against of it because he wants, when our body is more capable of doing babies. So it's always trust your body, your doctor, and the procedure, what you're going. Make sure you're getting the knowledge. Like, don't go blindly to a doctor and tell, I want to become pregnant. You can't become pregnant just by going to the doctor. You need to gain your knowledge from the doctor and learn so much about it. And then with my story, I'm coming from a different religion. But when I started this process with IIRRM, I thought IIRRM is only for some category of religious people. Then when I was traveling with that IIRRM facility, then I got to know it's not for some particular religion. It's open for everyone, and you're more happy to come and enjoy your babies with IIRRM. And I'm so grateful that today I'm holding my baby, and he will be 1 this Sunday. I'm so grateful for Dr. Whitaker and IIRRM team for giving me this opportunity. And trust your body, that your body can make babies. So always push yourself. Don't ever give up your body or anything. So many people give you suggestions that, hey, go for IVF, it's very easy road. But no, that's not easy because as we know that so many, back in India, my father-in-law told, for 25 years old women, they suggest going for IVF when she's capable of having a baby of her own. Because I started my family when I was 27, I became pregnant when I was 32. So becoming pregnant is easy, but knowing knowledge about your body and trusting your doctor is most important, I feel. And I'm glad that I got this opportunity to talk about it. I'm grateful for Dr. Whitaker. Thank you so much for everyone having me.
And so I just want to summarize. She had severe ovarian compromise from bilateral, so both her ovaries were attacked by endometriosis, which is a progressive disease when it is missed. And so unfortunately, when that does progress, it does lead to premature ovarian insufficiency, which she did have, which leads to severe ovulation defects, which she had. And so what would have happened? She would have been a poor responder to IVF. She would have been told to get donor eggs. She also was found to have not only stage 4 endometriosis at the time of surgery, but she had chronic endometritis, or an infection in the uterus. So if she had gotten donor eggs into her uterus, she would have been very high risk of preeclampsia, especially with pre-existing insulin resistance. It's similar to a smoldering fire of toxicity when you have all of those things accumulating for inflammation. Now, with her infection in the uterus, she would have been at risk for PPROM and other complications, which increases the risk of preterm birth, stillbirth, and death to the baby. So I want to emphasize, when we ignore or override these health issues, we should have on the CDC website not just the live birth rate, but mortality or the death rates for each trimester. We're talking about embryo loss, as well as stillbirth, as well as preterm birth, and not only live birth, but healthy births. And so this is also something that's missed in the data, but A woman that walks into the clinic, that's what she wants to know. She doesn't want to just have a live birth, but a healthy term birth. And so that's just really important to emphasize that she did have a healthy term birth. So it's not just about, that live birth like she said, and it's about trusting your body, restoring health. And so we have one more here.
Good afternoon. My name is Stephanie. I'm a wife, mother, and nurse practitioner, and I'm also an RRM patient. And I represent women growing their families later in their reproductive years, as well as those suffering from recurrent loss. My husband and I were married when I was 37, and we quickly conceived 3 children within the first 6 months of marriage, all of whom were lost to miscarriage. I sought care at several highly regarded GYN practices in the D.C. area. My miscarriages were approached with clinical indifference and dismissed as being age-related. With minimal workup done, I was advised to seek care at a clinic offering IVF. So recalling the countless patients I had had, friends and family members, who have used this technology, many with regret, negative outcomes, or at best ambivalence, I knew that I needed care that worked with my own physiology rather than circumvented it. I consulted with Dr. Whitaker, and a thorough workup was suggestive of endometriosis, low progesterone, and thyroid and clotting disorders, which were managed medically and surgically, and 1 year later, my son was delivered in perfect health at the age of 40. I suffered 2 additional losses during which I felt accompanied and supported by my physician. And then after an ultrasound and a lab-monitored cycle, we welcomed our daughter, 1 month shy of age 43. She's the little noisemaker in the 3rd row. In summary, I experienced 0 success before RRM at a much younger age, but welcomed 2 healthy full-term babies after the age of 40. I cannot imagine life without my children, but if I had to, I am confident that my challenges were addressed with evidence-based care, compassion, and without ethical dilemmas, diagnostic ambiguity, or any of the financial hardship that often accompanies ART. As a primary care and a psychiatric clinician, I can attest that, like me, women want to be functioning optimally. We deserve the thorough workup that comes with RRM. We deserve the detection of conditions with consequences far beyond fertility, including metabolic disorders, mood disorders, and chronic pain, among many others. The scope of healing that this specialty offers meets a critical need for women, and I really hope for robust support for this growing field. Thank you.
I think that was a beautiful summary, but it's really, we had a privilege of taking care of her for both of their entire pregnancies, and it just was wonderful to be able to take care of these women, not just discharge them in the 2nd trimester and not know what happens, but we get to be a part of their care, see all the investment that we put up front in the work of becoming a better mother, a healthier mother. And she was able to get choices, reduce her medical risk, reduce the financial burden, reduce the trauma of potentially creating many embryos and being called every day as they are dying. That would have been the other route that she would have gone through. They would have likely created many embryos, assuming it's a genetic issue, screened all of them, and gone through a process that way, potentially not evaluating the other issues that we did find out that did lead her to two successful healthy pregnancies. So thank you for summarizing it so beautifully.
Good afternoon. So I am Dr. Anna Mae Conley. I am a board-certified family physician based in Knoxville, Illinois. I have practiced RRM for 15 years since I started residency. I have the privilege of introducing Jessica Ernest, who was a patient who sought care with RRM after suffering 19 years with pelvic pain. She proceeded to get diagnosed after her first surgery with stage 3 endometriosis and endometritis. This led to a second extensive surgery. that excised her endometriosis. With RRM, we address both the female and male parts to fertility and health. Because of the approach of thoroughly investigating the cause of a woman's symptoms, hormone abnormalities in the cycle, we are able to diagnose and treat much more accurately. Our ultimate goal is to bring the woman back to a state of health and to avoid letting a woman continue to suffer and progress with a disease if it is inappropriately treated and not managed well. Every woman should be aware that this is an option. That is what I advocate for in my practice through our health system. It's not about choosing, it's about giving the woman an option and having the knowledge, as well as educating our students, our residents, our nurses about this. I think it's so important. I hear too much from my patients that I care for, the women that I treat, that they wish they would have known about this years ago, and it breaks my heart. So here's Jessica.
My name is Jessica Ernest, and I am a nurse practitioner from Birmingham, Alabama. This is my story. Following a second trimester miscarriage, I suffered a year of infertility. My OBGYN treated me with medications to help with ovulation for several months. When that did not work, I began to see a reproductive endocrinologist. His initial workup led to a diagnosis of unexplained infertility. For the next 8 months, I took more medicines and injections and had multiple intrauterine inseminations, but to no avail. After my reproductive endocrinologist did a 15-minute exploratory abdominal surgery, he said I was completely normal. However, I knew something was wrong and I needed help from someone else. It was at that time I discovered Restorative Reproductive Medicine, RRM. My RRM physician, Dr. Packus, took a much more comprehensive history, fleshing out details such as years of painful periods, bloating, urinary frequency, and brown menstrual bleeding. To further investigate, I underwent a 2-hour abdominal surgery and was ultimately diagnosed with stage 3 endometriosis and endometritis. As my endometriosis was diffuse throughout my pelvis, ovary, fallopian tube, uterine ligaments, and bladder, I would return to Dr. Packus in 2 months' time for an endometriosis excision. This surgery took over 4 hours. A couple months after my excision surgery and antibiotic treatment, my brown bleeding improved, as did my bloating and urinary frequency. Best of all, my period pain was almost non-existent. Now that my body is truly healed from disease and infection, I believe I finally have the chance to conceive again. I wasted 2 years of my life with unexplained infertility, and I suffered with chronic pain for 19 years. Thanks to RRM investigating my symptoms and treating me correctly, I feel like a new person. Turns out I never had unexplained infertility. There was an explanation all along, and for that, I thank Restorative Reproductive Medicine.
Hello, good afternoon. I am Dr. Monica Minger. I am here today as the U.S. Director of Communications and Development for the International Institute of Restorative Reproductive Medicine. I'm also a practicing clinician out of Cedar Rapids, Iowa, and we also provide telehealth services across the country. So I want to talk just a little bit today about the current state of RRM practices here in the U.S. And there's a lot of different ways that we talk about this, and one of the big things that I want to call to the attention of people that may not be aware of it is the difference between insurance-based versus cash-based or direct care concierge practices. And one of the things that is very important to point out here is that many RRM physicians who are practicing are needing to increasingly go to this direct pay model because the insurance model just doesn't fit what we need oftentimes. So the doctors that are practicing RRM are either able to stay in an insurance-based model if they are doing other care, things like OB, deliveries, surgeries, or other family practice. But those of us that are strictly RRM physicians, and that's all that we do in our practice, like myself, we spend a lot of time with our patients. A new patient intake appointment at my office is 2 hours. Insurance does not want to pay me for a 2-hour visit with a patient, and that's just the reality right now. So we definitely need more people doing RRM as far as healthcare professionals. We also need more exceptional surgeons providing high-quality endometriosis care. You've gotten the chance to hear from a handful of our surgeons today, which is fantastic. In the state of Iowa, we have no surgeons that I send my patients to. They have to travel 3 to 5 hours to get to a surgeon who is exceptional. And so really just the need for more awareness of this, but also for helping to get insurance reimbursement for this type of care. The other is I just want to address, because we've gotten a lot of questions on misinformation that has been provided by ACOG as well as ASRM. And I would just like to say that we as the International Institute are the only body that is able to speak about what restorative reproductive medicine is. In fact, we defined the term, as Dr. Parnell mentioned in her introduction, more than 25 years ago. And so oftentimes, we want to make sure that we're calling to light what is the actual truth. And so we did put out a press release as well as provided letters to both of these organizations. And so that press release is available on our website. And then I also want to introduce, there was recently a survey that was done earlier this year, and it was sponsored by the Women's Reproductive Health Foundation, and it was a survey of 1,000 adults across the United States. And this was a random survey that was done, reflected of the general population. And there is going to be a research paper forthcoming where you're going to be able to see all of the details and analysis of this. And we also looked at another analysis of a separate survey that was done by JL Partners. So I'm going to share just a couple of slides here because a lot of this I think is surprising for people. And one of the things that I will say is that both of these surveys showed that there was high favorability for both IVF and RRM. 80% of people supported both IVF and RRM. So this is not just a group of RRM loving people. And what this is on the left, you're going to see people that were concerned about an issue, and on the right, the lighter blue is not concerned. And the question here says, are you concerned that there is an undiagnosed underlying health factor for you and or your spouse or partner that might be the reason you've experienced a fertility challenge? And what we find is that over 50% of people thought, yes, there was something else that could be underlying why I was having troubles conceiving, including 83% of those individuals who had personally undergone IVF. And so it really highlights the point that women and couples know when there's something else going on, and we need to be listening. And then the other piece of the study here, there was another question. In your own personal opinion, if IVF and RRM were equally effective, do you think it's better for couples to utilize IVF or to utilize RRM? And here 53% of respondents said that it was better to utilize RRM and 24% better to use IVF, and then another 22% that said that they didn't know. So again, this is a published study now. There was a press release that came out yesterday, and the Women's Reproductive Health Foundation published that press release, and so we're happy to connect you with those resources for the entire survey data. And as we look forward to the future of RRM, we want to continue to expand research. We've been doing research the whole time. We know that this is an important factor. We get a little jealous sometimes here in the US. There are many countries across the world that are a little further ahead in the research than we are. But really the focus here is we want to improve patient and physician awareness of RRM, as really realizing this is a cost-effective treatment for many couples, and it should be the first line for most couples experiencing infertility. We have similar outcomes to IVF when we look at the published peer-reviewed data, and RRM helps to improve the quality of life and health beyond just fertility concerns. So thank you for that. Sorry for talking fast. I want to make sure we get to our last group of patient speakers here. So I will invite up Emily, Kennedy, and Tracy.
Thank you so much, Dr. Minger. I'm Emily Kennedy of Reply Fertility, and I'm here to introduce Tracy, who I served as fertility educator and health coach. Came to Reply Fertility in their 40s with a history of recurrent miscarriage. We've heard lots of those stories already. from natural conception as well as IVF. And they were advised more IVF due to their age. At Reply Fertility, they learned medically informative cycle charting, which paved the way for complete and precise evaluation of endocrine and pituitary systems. And her spouse was also assessed, diagnosed, and offered treatment. Within 6 cycles, they were pregnant, and for first time, they had their pregnancy hormones monitored during the pregnancy, and they have their beautiful baby daughter here with us today. So it is my pleasure for you to meet Tracy.
Hello, my name is Tracy. I'm an information security professional. I'm here to share how evidence-based restorative reproductive medicine transformed my life after nearly 5 years of reproductive health challenges. After 6 painful miscarriages and a diagnosis of unexplained infertility, I was told IVF was my only option. I underwent one expensive round, which failed, and later discovered there were hidden post-care costs that hadn't been disclosed. Despite the failure, I was encouraged to try additional IVF cycles without a clear diagnosis or understanding of the underlying issue. I began to lose faith in the process. Throughout this time, I felt frustrated, desperate, and overlooked by healthcare professionals who never sought the root cause of my recurrent losses. Neither my OBGYN nor reproductive endocrinologist performed comprehensive hormonal evaluations before or during pregnancy. In my search for answers, I turned to my faith in God, and I found IIRRM. Unlike other approaches, my IIRRM clinician took the time to investigate thoroughly. Through 6 months of detailed hormonal tracking across all phases of my cycle, menstrual, follicular, ovulation, and luteal, we were able to identify and treat the imbalances that had gone undetected for years. With targeted, evidence-based treatment to restore hormonal health, I finally became pregnant naturally within 6 months and welcomed a healthy baby. IIRRM is cost-effective, scientifically grounded alternative to IVF that focuses on healing and understanding the whole person. It improves outcomes, lowers costs, and most important, changes lives. It certainly changed mine. Thank you for listening, and because of IIRRM, I am a mother today.
Good afternoon. We've heard so many great stories today. My name's Dr. Lynn Keenan. I'm a retired clinical professor of medicine from the University of California, San Francisco. I'm also the current president of the Institute of Restorative Reproductive Medicine and one of the managing editors for our new Journal of Restorative Reproductive Medicine. But today I'm here to introduce a patient of Dr. Patrick Young, who was not able to attend. And as we'll hear from Marie's story, she struggled for almost 5 years. Initially went through the route of, she tried IUI, which failed twice. She was told that IVF was her really only option, but instead she sought options through restorative reproductive medicine and through, under Dr. Young's care, through charting his investigations and surgery, found out that endometriosis was the cause, and with treatment, was able to have not 1 but 2 children. I will let you hear the story from her, but one more thing. As I taught primary care and sleep medicine, I would have different residents rotate through with me. At one point, I had the daughter of the very prominent IVF doctor in town, who was also on the same career path to go into REI. And after she heard my lectures and saw it in practice of what IIRRM was, she had a much different idea of what RRM was. She said, this is great for all the women that do not qualify for IVF. She saw a need for both paths, and I think the country needs this. And so now, let me introduce Marie to tell her story.
Thank you. My name is Marie Guccione, and I am a dental practice manager from Missouri. I'm here to share my nearly 5-year fertility journey. My mother suffered terribly from endometriosis, so when I couldn't conceive, I wondered if that was my struggle too. But like so many women, I was swept into the IVF establishment. Because I had no symptoms, endometriosis was dismissed without real investigation. Instead, I was funneled into IUI and then IVF. After 2 failed rounds, I was told IVF was my only hope. Being told you have unexplained fertility is really a slap in the face. It is not an answer. The reason women hear this label so often is because the IVF system is built around one tool. If IVF is the hammer, every woman's infertility is treated like a nail. And if IVF is seen as the best option, it very quickly becomes the only option. But women deserve better. I sought care with Dr. Patrick Young at the Restore Center for Endometriosis. Through charting and surgery, we discovered I had stage 4 endometriosis and a blocked fallopian tube, serious conditions no IVF protocol had ever uncovered. 2 cycles after surgery, I conceived my first daughter naturally. Today, because of restorative reproductive medicine, I am the mother of 2 beautiful girls. It wasn't just me. RRM also gave my mother answers in her healing in her own journey. Because of her journey, I'm standing here today. Women with infertility and endometriosis deserve more than an industry that only knows how to swing a hammer. They deserve doctors who listen, true diagnosis and treatment, and access to care that is safe, effective, and fully covered, not just IVF. Root cause treatments lead to the answers women deserve, restored health and wellness, and the possibility of recurring natural fertility. Thank you.
Hello, everyone. My name is Ann Nolte. I'm a board-certified family physician. I've been practicing restorative reproductive medicine for 15 years in New York City, and I serve as the medical director for Catholic Health's 3 Gianna centers in New York and on Long Island. We provide RRM to approximately 600 infertility and recurrent miscarriage patients a year. As I explain to them how their cycles should be working, how their reproductive system should be working, where things go wrong, what we can do, their response is, why has no one ever said this to me before? And so, with that, I would also say that our patients, I believe, you've heard today, would also say it is definitely worth their time. Heather, thank you for being the grand finale.
Yes. Thank you, Dr. Nolte, and thank you all for giving me the opportunity to share my personal journey with RRM. I'm grateful that our lawmakers are taking the time to listen to the voices of those whose lives have been forever changed by this approach to healthcare. I'm here today to share my fertility journey, a journey that began with my husband 10 years ago as a newly married couple with dreams of becoming parents. At first, it all seemed to be unfolding perfectly. My husband and I conceived right away and were overjoyed. But just 8 weeks later, that dream was shattered. The feeling of joy was replaced with devastation as we learned the pregnancy was not viable. The grief that followed was profound, an overwhelming sense of loss. After our first miscarriage, we held on to hope and continued down the path toward parenthood, only to endure 9 more heartbreaking losses. Desperate for answers, we sought out a renowned IVF specialist, believing this might finally be the solution we needed. After many tests and several unsuccessful treatment protocols, he sat down with my husband and I and told us something we weren't expecting to hear. IVF was not the right path for us. Conceiving wasn't my challenge. Carrying a pregnancy to term was. He explained that IVF is not a one-size-fits-all approach, meaning IVF cannot solve all causes of fertility and miscarriages. His honesty, though difficult to hear, became a turning point. It nudged me to keep searching for answers, searching for a path that ultimately led me to RRM. This is when I found Dr. Carpentier. I quickly learned that his approach was far different from that of the IVF doctor and other specialists in the field that I had been in the care of. He spent countless hours trying to get to the root cause of my fertility issues, discovering an overactive immune system, addressing and treating my thyroid disorder, and recognizing the signs of endometriosis from my symptoms, and guiding me to surgery, which confirmed it. These were all things that had never been explored before. Dr. Carpentier was the first doctor willing to step outside the box, combining natural and medical treatments to address my underlying issues and create an individualized treatment plan instead of following a set standard of protocols. After experiencing 10 heartbreaking losses, we were finally able to welcome 3 beautiful children. Adeline, who has the courage to stand beside me today. Thank you. Thank you. And John and Valentina, who are snoozing in the back, like Dr. Nolte said, they are my greatest blessings. And they've given me the courage to stand here today and share my story. It's because of them that I'm here to advocate for families who are still struggling, just as I once was. Every family deserves the chance to experience the beautiful gift of life. While IVF has rightfully received a great deal of attention, RRM deserves just as much. Both address fertility challenges, but they do so through very different approaches. It is my hope that one day fertility care will embrace a variety of approaches, recognizing the value of both RRM and IVF. IVF should not be the only treatment option. When it is viewed as the only approach, we risk overlooking an entire group of people who face fertility struggles, but cannot benefit from that treatment, like myself. Your willingness to hear our stories gives us hope and hope to those who are still searching for answers. I thank you all for your time.
I want to thank all of our incredible speakers, our clinicians, and our patients who, again, their voices are what motivate us, and it's their voices that we want to make sure are paid attention to by all of those here and other places where decisions will be made about what care is available to them. We have gone over time, and my apologies for that. We will not be able to take questions, but we are hanging around, so if you want to talk to us, we're happy to chat with any of you. We do have on our website, we will have videos of the various patients' testimonials, plus a whole pile of other patients. We did have to narrow it down, and again, we're just grateful for the opportunity to be here, and we want to thank you for listening. Thank you.